Now we're going to kind of meet the winning companies. About 90 seconds each for them to introduce themselves, what problem they're solving, how they're solving it, what are some of their accomplishments to date. I'll try and ask a smart question to follow on.
I'm also a pediatrician, and Dr. Kraft, like you, trained in pediatrics and internal medicine, so I'm med peds, and have had the privilege for the last 2 years of working with GoCheck Kids as chief operating officer. And at GoCheck Kids, the problem that we're solving is one that's very familiar to those who work in pediatrics or in other settings where kids get preventive health screenings. There's a growing number of preventive health screenings that are recommended for children that pediatricians and others like school nurses and Head Start staff are juggling to fit into their assessments. And the visit lengths continue to be compressed and shrink. And so if you look at the recommended schedule, you have like a 30 by 30 matrix of screenings. And so at GoCheck Kids, what we've done is we've taken multiple screening devices that required specialized technology, and we've streamlined them onto a smartphone into a solution that can be used more efficiently in pediatric practices. We started with a vision screening that required an expensive medical camera and made it possible to do that on a smartphone for the first time 10 years ago. We added a vision test that's frequently done incorrectly in pediatric practices and is a big time-consuming test. And we made it where it could be done in a standardized way, again, on the same smartphone platform with a cloud-based portal. And then most recently have added hearing screening, another screening that even if pediatricians have the technology on hand, frequently goes undone because of how much time it takes, and we've made it efficient to do it on the same screening. So that's really the problem we're solving at GoCheck Kids.
Fantastic. And you're also not just doing vision, and my pediatrician uses your platform, Dr. Alan Green, but hearing, et cetera. And I also imagine that means you can bring out some of these screen tools outside of the pediatrician's office.
Yes, yes. So we're doing hearing screening as well. We launched it this past weekend at the American Academy of Pediatrics conference, so it's new. And yes, it can be used. We have people who use our platform now in Head Starts. They do take these out to the homes to assess children as well. So yes, it can be used outside of the office.
And last quick question. I imagine now with the medical selfie of looking at the eyes or the face or hearing with AI again, could you pick up other clinical signs that might be beyond just visual acuity?
Yeah. Yeah, currently we don't. However, we know that there are a number of other conditions that many researchers have been looking at the potential of being able to use those images. We know there's a lot of potential, particularly in neurodevelopmental conditions and behavioral health. And so it's an area that we've been watching closely, and we'd be excited to add to the platform in the future.
As we know, again, I'm training pediatrics and internal medicine, but we've also seen a dearth of solutions in the pediatric space where they don't get adopted or paid for, just like in the challenges across the adult world. What lessons have you learned that are unique to getting solutions out into the kids space, whether it's a pediatrician, physical therapy, and beyond? Any kind of quick lessons or insights?
We have certainly found that part of the secret to being able to innovate effectively in bringing digital technology to pediatrics and to pediatricians is when you can combine that with a code that's already reimbursed. And what we found with the vision screening codes is that we actually have seen over the last several years significant adoption of these codes as recommendations were strengthened by commercial payers, but we still have a good bit of disparity of adoption in state by state and Medicaid. So across the US, still a considerable percentage, nearly half of kids don't get their vision screenings, but that's not randomly distributed. The kids that are most likely to have vision impairments that will be missed, as well as most least likely to get screened, are kids who are on Medicaid. And we still have a number of states where Medicaid, just based on how slow the policy machines work, haven't updated their payment codes yet. So we've had to choose, you're a small company, you have limited resources, but we've had to choose at times to also engage in some state level advocacy, trying to educate, state Medicaids and others, because we hear from pediatricians that that's, one of their biggest barriers to adoption in those states is that Medicaid just hasn't gotten on the bandwagon yet with covering a recommended screening.